the purpose of this slide really is just to remind everybody that there are these rhythms, these circadian or diurnal rhythms in various aspects of physiology. So we see them in parameters such as cognitive function or neurohumoral parameters. We also see it with metabolism, of course, as Lou just mentioned, as well as, of course, with cardiovascular function. And so what you can see from this slide is just some examples of data from human subjects in which you can see when these healthy individuals sleep, you get a dip in blood pressure, a dip in heart rate, and then upon awakening, you get this steep rise in these parameters, and these parameters remain elevated throughout the day. But unfortunately, with that steep rise in blood pressure in the early hours of the morning, you also get this increased incidence of heart attacks and myocardial infarctions and sudden cardiac death, as Lou also mentioned. And that was first described by Mueller back in the 1980s. We also know that if circadian rhythms are disrupted themselves, for example, shift workers, or through changes in your behavior, such as eating late at night, or even through genetics, that this increases risk of various cardiometabolic diseases, including the one that we're here to talk about today, that being heart failure. So here's just some data from shift workers, a great example of a disruption of a normal circadian life. And you can see here through this meta-analysis that there's about a 7% increased risk of myocardial infarctions in this population. Now, we now know that there are these so-called clock genes that are governing various processes in our body, and they're governing them in a temporal manner. So they're making sure things happen at the right time of the day. And so therefore, if you disrupt this mechanism, things are going to happen at the wrong time of the day, and that, we believe, is leading to pathology. So at the heart of this mechanism are these two transcription factors right here in the middle of the slide, clock and BMAL1, that when they heterodimerize and they bind to target the promoters in target genes, they're going to induce those genes. That includes negative components of the clock mechanism that are going to feed back on the clock BMAL1 heterodimer and shut them down. That includes the period and cryptochromes as well as reverb alpha as shown on this slide. In addition, clock and BMAL1 are also going to regulate other genes inside the cell, and that in turn is going to lead to these rhythms in biological processes. So it's going to lead to an output of the clock. Now, we're here today to talk about heart failure, and so what we do know is that if we take an animal model, we target that central heterodimer, we basically genetically ablate the mechanism by getting rid of BMAL1 in every cell in the body, completely screws the animal up. Okay, every single parameter in the body is absolutely messed up. These animals die at an early age, and what they die of is heart failure. So here you can see this is data from Karen Esser when she was in Kentucky. Now she's in Florida, in which she looked at the BMAL1 knockouts, and you can see here this age onset decline in fractional shortening. And in other data in that paper, they show dilated cardiomyopathy. But there aren't really going to be very many humans walking around in which the clock has really been completely ablated. In contrast, probably what happens in humans is that we're out of synchrony with our environment. So there's a phase shift in the clock. Okay, so the clock is not aligned with the environment, such as shift workers. Well, it turns out that there's a natural mutation in hamsters in a kinase known as casein kinase 1 epsilon that leads to a clock that has a periodicity of 22 hours, not 24 hours. So this animal is in constant misalignment with the environment. If you age these animals, you see that you get this age-onset cardiac dysfunction at 17 months of age. The interesting thing, and this is the cool thing about this experiment, is if you take these animals and you essentially put them on another planet, so you house them in a 22-hour day, so 11 hours of light, 11 hours of dark, and that's shown in the black line right there, you absolutely prevent the cardiac dysfunction with age. So it really shows that you have to have this alignment between your endogenous clock and the environment in order to maintain a healthy heart function. Now, we now know that these clocks are everywhere in the body. So previously we used to think, oh, a clock, it's in the brain and it's regulating sleep, and then that in turn is regulating a whole host of biological processes. Well, that is true. However, we now know that these clocks are present in every cell in the body, and what they're doing is locally they are regulating the function of those tissues in a time-of-day dependent manner, and that includes the heart. And so what we did many years ago was we decided to genetically ablate the mechanism, specifically in cardiomyocytes, and look at the outcome. What we found was that when we do ablate the cardiomyocyte clock, again getting rid of BMAL1 only in the cardiomyocytes, we see the same phenotype that you see in the global knockout animals, in which you see this age-onset dilated cardiomyopathy, and they have a reduction in lifespan. None of them live past 1 year of age. It's quite dramatic. And the data on the top here was generated by Ganesh Halade for us, and you can see that there's also this hypertrophy, this very dramatic hypertrophy and fibrosis as well. Not only that, but we've also found that risk factors for the development of heart failure also seem to switch off the clock, or at least attenuate the clock. So here on the top, you can see if we induce ischemia reperfusion in animals at the beginning of the dark phase, these were rats, we find over the next 24 hours, you see an attenuation in the clock mechanism. So here the best example is in DBP. Over here on the right, you can see in the black that within 24 hours, you have a dramatic attenuation, a halving of this clock output gene. Now, when I was in Heinrich's lab, and I guess this was now 18 years ago or something like that, when we actually did the studies, what we did was we induced pressure overload in rats. This was a compensated hypertrophy. It wasn't failure, but this would be the beginning stages. And you can again see an attenuation of the clock mechanism in the heart. So what I've shown you so far in terms of published data is that if you disrupt the clock mechanism, either globally or locally, it leads to heart failure. And that situations or risk factors that are going to increase the risk of heart failure, such as ischemia reperfusion and pressure overload, that attenuates the clock mechanism. So what I'm going to talk about now are 3 questions that we're trying to address, and I'm going to show you only unpublished data from now on. First question is, how does circadian disruption actually lead to heart failure? What do we think is going on? What are the mechanisms? Can we target this clock mechanism for the treatment of heart failure? Is that even a possibility? And then is it possible also that disruption of clocks outside of the heart, such as in the immune system, is that going to increase the risk of heart failure? Okay, so first of all, I'm going to focus on this top one. So here, just to begin, there is a little published data. I apologize, it's not all unpublished data. Just to remind you that we've made these 2 animal models in which we've targeted this clock BMAL1 heterodimer only in cardiomyocytes. The one on the right is the one I introduced you to before. You get rid of BMAL1 in the cardiomyocyte, and therefore the clock goes away. The one on the left is targeting the transcription factor clock. We couldn't knock it out because there's a compensation by NPAS2. Instead, we made a dominant negative mutant, and we expressed it only in cardiomyocytes. When you look at these models in an unbiased manner, you look at the hearts, you can clearly see that genes that were rhythmic in wild-type hearts, they're now completely arrhythmic. There's no oscillation whatsoever in these hearts. And in fact, it turns out that up to 10% of the transcriptome is regulated by the cardiomyocyte clock. Well, that's a lot of genes, okay? 10% of 20,000 genes, that's 2,000 genes. How do we narrow this down to try and interrogate potential hypotheses? So what we did was we took that data and we said, first of all, which genes are oscillating only in wild-type hearts? And of those genes, then, which oscillations are completely lost in both models, CCM and CBK, the clock mutant and also the BMAL1 knockouts. Of those, which do we know from work in the liver have a binding site to which BMAL1 can bind in the promoter? And then of those which have conserved E-boxes across multiple species, including humans. When you do this analysis, very stringent, you only get 9 genes that pop out. And so here are those 9 genes shown in a table. And you can see that these genes are involved in various processes, including signaling and metabolism and even protein turnover, as well as some clock components. And so when we rank these genes, at the top you can see the most highly induced genes in our models, and at the bottom the most highly repressed genes in our models. I highlighted in yellow those two extremities there because there's a known relationship between those two particular genes. And it makes perfect sense that when you get that BMAL1 and clock, when they heterodimerize, we know that that induces the gene that's on the bottom here, that's the most highly repressed, the REV-ERB, both alpha and also beta. And we know that REV-ERB negatively or represses, has a negative relationship with this NFIL3, also known as E4-BP4 that Mary mentioned this morning in her talk. So it makes perfect sense, doesn't it, that if you get rid of BMAL1 or clock, such that now they have low activity, that REV-ERB alpha levels are going to drop and E4-BP4 levels are going to go up. The interesting thing is we don't know anything about the roles of REV-ERB alpha and E4-BP4 in the heart. Absolutely nothing's been done. So what we decided to do, and this is work that I'm going to show you that's unpublished by Shobhuj Mia and also Ravi Sonkar, who are postdocs in the lab. What they decided to do was they said, okay, well, first of all, rather than making a genetically modified animal, let's pharmacologically reactivate REV-ERB alpha in the heart and see whether it prevents the heart failure. And it actually did. So what you can see here is that when you give this drug called SR9009, which is an activator of REV-ERB alpha as well as beta, you can see that E4-BP4 levels drop in both wild type and also the CBK animals. And that when you look at the heart's ex vivo at function with a parameter such as rate pressure product, which is a marker of contractility, you can see that you normalize. Within 1 week of treatment of these animals, you normalize contractility. Not only that, we also saw a decrease in cardiomyocyte cross-sectional area. Again, I mentioned that Ganesh and we had also seen a hypertrophy in these particular hearts. So what we're doing now is we've actually generated a cardiomyocyte-specific knockout of E4-BP4, has not been investigated previously, and the plan is now to take that animal and cross it with our CBK animal to see if we normalize E4-BP4 levels in an animal model in which the clock has been disrupted, can we prevent the cardiomyopathy? Here I'm just showing you some data, preliminary data from those animals. When you knock out E4-BP4 in the hearts are perfectly fine. They're doing great. Function is great. And you can actually see, Heinrich, that E4-BP4 seems to regulate cardiac metabolism. Fatty acid oxidation doubles in these hearts. So we're very excited about that. Okay, so that's kind of some of the directions that we're going for that first question. We're also looking at other components that were in that table as well, including we've recently published a paper on insulin signaling because one of those components was a regulator of the insulin signaling cascade. What I'd like to do is I'd like to move on to this second question because I told you that when we give this drug that reactivates REV-ERB alpha, that it is beneficial in our CBK model. It prevented the heart failure. Well, it turns out that in the last year there have been multiple papers that have been published that have looked at that same compound in animal models of cardiovascular disease, including this study here by Mukesh Jain where they took wild-type animals, they induced pressure overload to an extent that would lead to heart failure. When they give this REV-ERB alpha agonist, the same one we used, they found that it attenuated the heart failure progression. It's also beneficial in the setting of atherosclerosis and also in the setting of myocardial infarction as well. All these papers have been published in the last 18 months. So this is really a hot area of research right now. So it does seem that targeting the circadian clock, whether it be REV-ERB alpha or other clock components, may have some benefit in terms of heart failure. What about other clock components? Well, we heard this morning from Mary Lindsay's talk as well as Ganesh Halade's talk in this session that macrophages are very important for the pathogenesis of heart failure, especially in the setting of ischemic heart disease. And so this is just a slide to remind you of some of the work that Dr. Prabhu has also published, as well as many others in the field. It turns out that there's a clock, as I mentioned, in every cell in the body, and that includes macrophages. And as you can see from this slide, this image over on the right, that at one time of the day, the macrophages are more active than at other times of the day. And so that's important because when you wake up in the morning, you want to have your immune system active so you can defend yourself against any kind of infection that might occur if you were to cut yourself or you've been bitten. When you go out and you forage for food and you avoid predation. Whereas when you sleep, then the immune system can die down a little bit and they can repair. So we hypothesize, and this is work with Dr. Prabhu, as well as postdoc Samir Rana, who is here in the audience, in which, again, the study started with a microarray. First quick look at human macrophages during heart failure, as well as in an animal model of heart failure, and looking at macrophages. And what you can see in this very busy heat map is that clock genes were clearly being altered in the setting of heart failure in both humans and also in mice. And so when you perform RT-PCR follow-up for the animal model, you can see that many of these clock genes are repressed, and this matched up perfectly with the data that Mary showed. You can see that there's a decrease in BMAL1, and you can see that there's a decrease in reverb alpha, and as Mary showed this morning, there's also an increase in NFIL3, that E4BP4. So what we decided to do is we said, okay, well then maybe during heart failure, the macrophages are chronically stuck at an excited time or a pro-inflammatory time of the day. And so what we did was we genetically ablated out of monocytes using the lysine-3 promoter. We genetically ablated the clock by targeting BMAL1. When you do that, you see the same relationship as I showed you in the heart-specific model. And when you look at the macrophages, you see BMAL1's low, reverb alpha is almost gone. And you can see this chronic induction of NFIL3. The exact same pattern that we find and Mary finds happens in macrophages during heart failure. When you take these animals and you induce a myocardial infarction in them, you find that there are worse outcomes. So you can see here, if you just focus in on the panels on the bottom, especially the second over from the right, you can see ejection fraction right there. You can see that there's a greater level of heart failure in these preliminary studies, which are still ongoing. And this is work, again, by Samir. So then it leads to the question, well, what if we get rid of E4BP4 then? That should be beneficial, right? Because here we're seeing that if you get rid of BMAL1, E4BP4 is up. And we're saying that that might be detrimental. So we've made a monocyte-specific E4BP4 knockout. And again, with preliminary data, this looks very exciting. You can see here on the panel all the way over to the right, when you take a homozygous knockout animal and you compare that to a wild-type animal in blue, you can see that when you induce a myocardial infarction in these E4BP4 knockouts, that they are protected. So they have a lesser effect with regards to depression and ejection fraction. So it does seem that disruption of clocks, not only in the cardiomyocyte, but maybe in the immune cells as well, is going to increase risk for heart failure pathogenesis. Well, unfortunately, these drugs that are going to reset the clock, they're not available yet for humans, so you might be wondering, what in the world can I do? Okay, I mean, hopefully I've convinced you that if the clock is disrupted, and it's so easy for us to disrupt our clocks, trust me, we do it every single day of our life. What can we do? Can we change perhaps our lifestyles to help reduce this burden? And indeed, so what we're doing right now is we're studying obesity cardiomyopathy, and this leads back to something that Lou mentioned about eating at the wrong time of the day. So what we've done, and again, this is with a big group of investigators now, which we collectively call the AMC 21 crew. But for the heart studies, this has been headed by Shobuj, Mia, and also Ravi. So if you feed mice chronic high-fat diet, chronically for 20 weeks, you see this diastolic dysfunction. You see this obesity, you see hypertrophy, you see fibrosis, slight enlargement in wall thickness, and you see this diastolic dysfunction. And so others have been studying this, and it's been suggested that this might be due to an excess amount of fatty acid species that are lipotoxic that accumulate within the heart. Well, I don't know if you knew this, but when you feed rodents a high-fat diet, what you do is you completely phase shift the rhythms in lipids in the circulation. So in a normal animal, lipids, especially non-esterified fatty acids, are higher when the animal is sleeping. You feed them a high-fat diet, now the lipids are peaking during the active period. They're consuming more lipid, so it kind of makes sense. Well, unfortunately, during the active period, fatty acid oxidation in the heart is very low. So you've got a mismatch. You've got more supply, but lower fatty acid oxidation. And what we've shown previously is that during the active period, the heart loves to store fatty acids as triglyceride. So now what you've got the problem with high-fat feeding is that you've got high lipids during the active period, and you've got a high propensity to store those lipids as triglyceride. And so what happens is that if you look at the hearts during the active period from animals that have been fed a high-fat diet, you see this huge amount of steatosis. That steatosis is going to provide, is very labile because when the animals sleep during the light phase, you can see the levels reduce again, and therefore are going to be releasing fatty acids within the cardiomyocyte that might provide substrates for lipotoxic species. So we said, well, can we alter the behavior of the animals to try and normalize this? And so this is my last data slide. And so what we decided to do was we decided to, after 18 weeks of high-fat feeding, so we got them nice and fat, and they had contractile dysfunction and they had steatosis. We said just for 2 weeks, if we let them keep on eating that high-fat diet, but we only let them eat it during the active period, and we prevent them from eating that high-fat diet during the sleep phase, similar to us eating a high-fat meal before we go to sleep, is it going to show any benefit? And in fact, it does. So you find that if you do that, that you get an augmentation of fatty acid oxidation in the hearts of these animals. You see that contractility goes up, posterior wall thickness goes down, and you see the level of steatosis is dramatically dropping in these animals. So it definitely seems to have a benefit. And so it seems that we can change our circadian behaviors, such as being careful about what we eat at certain times of the day to improve cardiac function. So with that, I'd just like to thank the people that did the work. As Lou mentioned, I have a long list of collaborators here at UAB, which I'm extremely grateful to. Dr. Prabhu, Karen Gamble, Ganesh Halade, David and Jennifer Pollock, and so many more, as well as, of course, the talented postdocs that really have done all the work. And with that, I'd like to thank you for your attention, and I'm happy to answer any questions.